Hi, I'm Noreen Barker. I'm an MS consultant nurse. I've been an MS nurse since 2008, and before that I was a bladder and bowel specialist nurse. So I've been talking to people about how to manage their bladder and bowel symptoms for most of my career. Here are my top 5 tips on how to manage your bladder and bowel. Number 1, you're not alone. Bladder and bowel symptoms are really common in MS. So if symptoms do occur, what's most important is to talk to somebody about it, as symptoms can often be treated, if not managed, really effectively. Number 2, understand what's happening. MS can affect the way that impulses travel down through the nerves in the central nervous system, so that's the brain and the spinal cord, and may interrupt the messages getting through to your bladder and bowel. So therefore, common symptoms might be having to rush to the toilet more often than before, maybe going more frequently, or having to get up more at night time. Or it could be constipation or poo leakages. Number 3, talk to someone about it. If you're having symptoms, it's really important to talk to your healthcare professional about it. So if you've got an MS nurse, it could be them, or it could be your GP or your neurologist. What's important is that they can begin to make sense of the symptoms that you're having and possibly refer you on to your local bladder and bowel service. There, if you're seen, they may do a specialist assessment to look at what's happening and therefore come up with a treatment plan to improve your symptoms. Number 4, take action. If you're having symptoms, it's really important that you talk to somebody about it. To try and sort those symptoms, sometimes it can be as simple as changing your diet and your fluid intake, so making sure that you're drinking enough fluid and that you've got enough fibre in your diet. Activity can also help, so staying as active as possible. There is no set exercise that people with MS should do, but doing what makes you feel good and keeping moving is really important. Pelvic floor exercises can help some bladder symptoms, particularly needing to rush to the toilet or little leaks. But what's really important is overall talking to somebody about it and following the advice that they give you. So urinary tract infections are really common in MS, and sometimes they can be a message that your bladder's maybe not working as effectively as it did before. The simple fact that urinary tract infections can make most MS symptoms worse, so you need to take action. If you have any symptoms of a urinary tract infection, so that might be rushing to the toilet more than before, burning or stinging when you pass urine, or any blood in your urine, you need to do something about it straight away. 5, reach out for support. There's lots of information about bladder and bowel symptoms out there on the MS charities websites, so look at the booklets, the podcasts, the video clips on there for lots of advice. There's also Bladder and Bowel UK and Bladder and Bowel Community who can also help. So thanks for watching this video. I do hope that it's been helpful. Don't forget to check out the other videos in this series, as there'll be other helpful advice. But most importantly, you're not alone, so please do reach out to your healthcare professionals if you're having any bladder or bowel symptoms. Remember, you're not alone. Visit our website to find out more about difficult MS symptoms.